Okay, everyone, welcome to the New Frontiers in Eye Health, exploring microcurrent goggles to heal the eye. By far, one of our most popular topics among everyone, and there's a good reason for that we will get into very, very shortly. So, in this webinar, we're going to be discussing the eyes, eye disease, how they degrade, and of course, most importantly, how to fix them. We're going to be working on the most up-to-date information, including additional protocols for different conditions, talking about the safety precautions, if there are any, and revealing changes to protocols as well that we've made for optimum eye healing. Our previous training was missing a handful of conditions. This one has been updated based essentially on demand from clients that have meant we've had to actually build these protocols in or dig them out of the archives from back in the day. I'm Dr. Rob Van Bergen. Many of you all know me already, but I see a lot of new faces here as well. I'm a doctor of natural medicine. I'm a doctor of humanitarian services, PhD in natural medicine. I am not an eye doctor. So surprise, surprise, I'm not here claiming to know everything about the eye. What I want to teach you about today is what is very much an off-label treatment, meaning that the FDA does not recognize this as an official treatment with our equipment. But really what I've learned from working with clients, patients, individuals, other practitioners about eyes and how microcurrent can heal them, and really to turn around most eye conditions, if not all of them. So what I'm sharing with you today is by no means my expertise, but it's certainly something that we've kind of been forced to become knowledgeable about over the years due to the high demand. I have my bachelor's in holistic sciences. I completed that in 2019, and that's when I went on focusing all my studies on microcurrent as well, all that they would let me do to complete my doctorate and my PhD in natural medicine as well. So what I would consider myself an expert on is microcurrent therapy, and that's really where we're getting into today. It's the application of frequencies in the body and the body electric to right the electrical system of the cells and allow them to start working properly again. So this applies to most of the body, right? If not every part of it. And this includes the eyes. And this is something that people get excited about because they don't often consider eyes as a problem until they are. And when there are a problem, there's not normally a very easy answer to them. So this is part of the reason why I don't think we really worry about our vision until we lose it. And just like our health, we're bound to the idea that we are impervious to major problems until we experience them. For most people will experience chronic pain and will kind of know what it's like. You know, we experienced pain before in our lives, but many of us haven't lost our eyesight. Now, we take for granted that we can see and that we'll always be able to see, whether we need glasses, contacts, or what. We seem to have this belief that we will be fine. But then when we do lose it, right? When we do start to lose it, it starts to degrade. It really kind of throws us for a loop because it's not what we expect at all. And the unfortunate truth is that left unchecked, at least 75% of us will suffer from some eye issue at some point in our lives. And it's just natural aging, if you want to call it that. But we don't necessarily believe in aging being a guarantee. Whether it's poor vision, whether it's eye disease, poor eye health seems to be a natural consequence of aging. But why? What is the why behind all of this? Now, I'm pretty young, 35 this year, but I actually experienced vision loss a handful of years ago. Many of you who've been around with us for a while will know this story because it was supposed to be doing a training for you guys, and I was doing a crash course training video. And I was reading a book, like the spines of books on the bookshelves, and my vision I couldn't focus on it anymore. Everything became blurry whenever I tried to read. And it was actually terrifying. It really threw me. And the vision didn't come back for about 12 hours. For me, that was enough to realize how much I took my eyesight for granted. It was kind of simple, really, right? It was an ocular migraine is what it turned out to be. The only one I've ever had, and I never want to have another one. And they totally took my vision out. So since that point, I've taken much better care of my eyes. Microcurrent for the eye has become part of my daily health regimen. Those of you who remember me from years back, or even if you look back at some of the videos we did, myself and my dad, Dr. Hache, did together, you'll see I was wearing glasses back then. Well, I showed my glasses on a video the other day. I found them in my office. They're so covered in dust because I just don't use them anymore. So for me, taking care of my eyesight is extremely, extremely important. And this is part of one of the reasons that I like doing this teaching so much, because it really helps other people realize that importance too. But again, we don't really know what we're missing until it's gone, right? So not just the lines for song, but also kind of a part that is a thing that is extremely true. And while again, it's true for chronic pain, it's true for everything else, eyesight is something that we rely on for everything. So all of this aside, many of you probably are already aware of this, and that's why you want to be here. Let's talk about how eye disease sets in. So a lack of ATP, which is adenosine triphosphate, is how cellular energy, a lack of circulation, maybe it's trauma to the eye, you get bashed in the eye. Regardless, the trigger is met that starts the process of cell death. So as cells fail to meet the required electrical level to reach their action potential, they will fall short of reproduction and regeneration, and eventually they give up on functioning. So this little diagram here on the side is showing the membrane potential of a cell. Now, for anyone that's like, oh God, I don't know, what's he going on about now? Don't worry about it. You don't have to understand this part at all. I'm just gonna go through it and explain it for those of you who really are interested. So essentially what happens is as the cells try to build energy from stimulus, they reach this threshold. So threshold here is where this red line is pointing to, this little red arrow that I've got drawn already on the screen. So that's threshold. You can see the word threshold here. That's where they need to achieve that level of energy so that they can depolarize and then repolarize again. So if this action potential fails, because what will happen is they should reach threshold. You see this green line on the bottom. They get some stimulus. They get enough stimulus that it shoots up to threshold and it triggers this process of depolarization and repolarization, meaning that they're actually opening and closing the cell gates and essentially allowing energy and function to occur. Now, as this happens, the cell then returns below the threshold and rests for a bit. Now, the issue lies in when it doesn't make it. And this is happening with every cell all the time. You'll see my kind of orange line down here that I've drawn already, starting here. So let's say you're going along this line and you get your stimulus and repeatedly it never reaches threshold. So it tries a few times, it never reaches it. Now eventually it just gives up and it kind of dies off. And this essentially leads to the start of cell death because the cell then does not have the capability of reproducing and it stops. Now, a cell that is no longer functioning becomes fodder for disease. It's one of the things that can start cancer, right? It can start any disease in our body. And the same goes for eyes. So this is the same thing throughout everywhere in the body, but the eyes are such a small concentration of tissue. And even though when we're talking cells, we're talking trillions of cells in our body, so it's not a small amount. In the grand scheme of cells in our body, there's a fairly small amount in our eyes versus everywhere else. So because so much goes on within the eyes as well, the tissue is at a higher risk of failing electrical potential. And this can rapidly spread. This can end up with a dramatic impact on vision and the development of a lot of the conditions that we're going to be talking about today. So the rods, the cones, the Mueller cells, and so on are all integral components of the eye, and they all rely on a combination of circulation, which delivers oxygen and nutrition to the eye, and consistent electrical potential in the tissue, which is what we just talked about. If these things are not present, then degeneration sets in within the eye, and it manifests in the form of eye disease. So I don't know enough about eyes to make the claim that it's all eye disease, but the root of most eye disease ends up being a lack of that circulation, a lack of the delivery of nutrients and oxygen. And you can see in the diagram here, the choroid delivers blood flow to the eyes, and in turn, it delivers nutrients and provides the oxygen required to stay healthy and repair. So if the blood flow is not sufficient, the eye begins to break down, whether it's the optic nerve, whether it's the cells of the eye itself, they start to break down. Now, in the case of the cornea, it's slightly different. The cornea actually does not have a blood supply. It gets its nutrients from a combination of our tears and the nerves in the body as well. So this means as long as the eyes have a strong blood supply to them and the sufficient nutrients, then they shouldn't degenerate, meaning they shouldn't break down and get worse. So everything that we have on nutrition, on eyes out there, talks about nutrition for the eye. We often look at people's bodies and we talk about how, it's totally acceptable and possible that without any proper nutrition, you can use microcurrent to fix a damaged arm, right? Is it going to be better if you have good nutrition? Absolutely. But if you're poor nutrition, you don't have to take a bunch of supplements to heal your wrist. However, when it comes to the eye, it's a very, very crucial part of it. While microcurrent and scalar are great eye tools, they stabilize and they even reverse eye conditions. What they don't do is they don't make the nutrients you need out of thin air. So if you don't have those within your body, they can't make it to the eye. So if microcurrent is the trucks delivering the materials to the construction site, it can only do that if it can only do the rebuilding. It can only do anything with them if you have the building blocks in the first place, right? If there's no materials, there's no building that happens. So it's a very important part of the nutrition. And there are three kind of key nutrients. Most people aren't going to get enough of these from food. And I'm a big advocate, if you took the reset with me, I'm a big advocate of food over supplements. I think that food, it is more bioavailable, good quality food anyway. It gives us the nutrients we need. We don't need to spend the money on supplements. We just need to eat the things and we will get the benefit. However, with eyes, it's quite a bit harder to get enough of these nutrients, especially if we're combating an eye condition. So supplements, this is one of the few supplements we do actually offer because there's a gap out there. There's something that's missing that was very frustrating for a lot of clients for a long time. Now, the two very important ones that are also extremely common are lutein and zeaxanthin. So these are carotenoids the lutein is found in large amounts in healthy eyes. So it's a good thing we want it in there. And the second one is the zeaxanthin. Now, these things are very common in eye support supplements. You'll probably find them in most as the two ingredients. That's all that's in there. However, what we have found and what the National Eye Institutes have found is that without an amino acid, particularly the one they used was L-taurine, not taurine, L-taurine. Without this amino acid, the nutrients don't actually activate within the eye. So this is the kind of missing piece. And for years, we had a supplement bundle we sold. We had a bottle of lutein and a bottle of zeaxanthin, and then we eventually got them combined into a one. But what we couldn't do is get the L-taurine in there as well. So people actually had to either source out a different source of that, which was very hard, or to use a protein powder that was whey-based, which would go against a lot of people's diets and dietary needs. So we actually ended up building a supplement that's all in one of these things finally, and I'll talk a little bit about that later as well. But these key nutrients are essential for resolving eye conditions, and whenever I run into people that are not getting better with their eyes, it's typically the question I'm going to ask is, are they taking the supplements? Because without them, we don't have the building materials to rebuild, right? We are just standing around the construction site without microcurrent workers waiting for those nutrients to be delivered. Now, microcurrent is what we're mostly going to be talking about here today, and it has a history with eyes. As early as the 1990s, microcurrent therapy has been used to treat the eye. You use a nice wet towel, some gator clips, you clamp them on there, strap it onto your head, and people were able to use this to deliver the currents to the closed eyes. So treatment has come a long way since the wet towel days, even though some microcurrent technology still sits with the wet towels. So what does microcurrent do for the eye? Well, understanding how microcurrent stimulation can support eye disease depends really on knowing about cellular energy. Each cell in the body has a power source called ATP, right? That's your adenosine triphosphate. I mentioned that a little while ago. This is a chemical in your body that acts like a battery. And ATP allows the cell to use energy. So the cells in the eye's retina are going to need that ATP as well. This provides power to remove waste and to keep the membrane of the eye viable. Waste removal plays a role in many diseases. We talk about the lymphatic system a lot with microcurrent because that is part of your waste removal system. Dry macular degeneration, for example, is marked by fatty deposits called drusen, which accumulate in the retina. And if you have dry macular degeneration, you're probably very well aware of what that is. As we age, this is the problem, right? No matter how hard we try, circulation and ATP presence in the eye decreases. So first off, your cells are going to start degenerating because of that. And I think it's a priority thing. I mean, as much as we prioritize our eyes, they're not essential to life. And our internal organs, like our organs down here in the core of our body, get prioritized a lot more than our eyes. And I think that just reduces that circulation. This can also be the result of inactivity and other things as well. But the fresh blood that we get from increased circulation will nourish eye cells and tissues, and it delivers the building materials, right? It's going to bring it all in. So really, in this way, using the correct frequencies on the eyes is what we want to do, because this will increase blood flow by a nice large amount, which will be, it's like watering your plants, right? I mean, if you don't water them, they're going to die. Any dormant retina cells as well are re-energized by the microcurrent, and it allows them to remove more waste products. So they're actually clearing out the junk. Less waste will allow more nutrients to circulate, and this will in turn improve cellular communication. So what eye conditions can microcurrent treat? My goodness, it's pretty much all of them. We're constantly looking at new ones because people are coming in and saying, oh, what about this? And we can come up with a protocol for that. But we've had success specifically with an array of vision issues, including scar tissue, eye fatigue, eye spasms, myopia, amblyopia, astigmatism, age-related macular degeneration. Now, we're going to talk about the difference between dry and wet macular degeneration in a little bit, guys. But typically dry is way easier to treat. Cataracts, acute glaucoma, we'll talk a little bit about non-acute glaucoma as well. Subconjunctival hemorrhage, acute retinal detachment, injuries of the eyes, obviously, presbyopia, uveitis, and more. Yes, we'll be talking about floaters and all of those things too. However, this is just an example of some of the things that we've worked with directly that we've gotten great experience with. Okay, so the delivery system here is, instead of a nice big wet towel, is our microcurrent goggles. And many of you probably aware, I recognize so many faces here, I'm pretty sure a lot of you guys already have your microcurrent goggles. These goggles have multiple electrodes stationed around them. You can see that here in this on my screen. And these stimulate the eyes. They also have one electrode on the center, which will actually often sit on your closed eyelid, and it will stimulate the eye directly. So what you're doing there is you're delivering the current to the entire eye, the orbit of the eye, and the eye itself on both sides at the same time. So really, what we want you to do is you take the goggles. This is a pair of goggles here. You can see they strap on like they just have like a clip. They strap on, they plug in, you close your eyes, and you run your treatment program. I'm gonna wear these a little bit like this so that I can keep presenting, because I'm gonna need them in a minute. So essentially, as silly as they can look to be on, what they actually do is they are allowing us to deliver the current to the eyes. Why do we do this over just taking like a Y probe or the device itself and putting it on the eye? Well, the current is actually toned down a fair bit with the goggles. It's spread out and damped, which makes it far more comfortable for treating the eye. Beyond that, treating the opposite side of the body is always beneficial. So even if you have an issue with one eye, treating both at the same time is great. And beyond that, what we ultimately want to do is we want to get that simultaneous stimulation of all those trigger points and reflex points around the eye and on the eye itself. So there's really 3 different reasons that we would want to use these goggles in that way. So how do we treat? So typically you may want to think about different frequencies, and I'm going to talk about each individual condition, but what I want you guys to understand is that there's a certain set of frequencies that we like for eyes, because these different frequencies do different things. Now 7 to 12 hertz, so when you don't know what to do or when you need gentle eye stimulation, this is the way to go. This is available in your Evolution, in your Pinnacle, your Pro Sport. Not only does this program help repair and relax muscles, but it's also excellent for quick and gentle circulation enhancement. So if you're concerned at all, this is the frequency to use. 77 hertz is essential, and plays a role in why a lot of the devices that are out there can't deal with eyes. 77 hertz means we can clear scar tissue with the eye, which will begin to develop as the breakdown and repair keeps trying to occur within the body. So chances are if someone's got a bunch of eye conditions, they've got scar tissue they need to clear, and if they don't clear it, they're not going to be able to fix it. Scar tissue with the eye can really reduce that ATP and that electrical potential, so this one is essential too. 121 hertz, this is more commonly available in the devices. It's used for anti-inflammatory treatment, delivering it really deeper into the eyes, the optic nerve, and so on. It's not as commonly used. You'll find it's probably in 1 or 2 of the protocols, and it's used for glaucoma quite extensively. 32 to 45 hertz, we do use this one for macular degeneration. That will make it one of the most important programs for common eye problems as well. That's the Gamma program. Again, it's available in most of our machines. FMRSI or VASO, these are for optimum circulation. So you want to enhance blood flow, these are the modes to use. Is there a preference? Personally, for eyes, I tend to use FMRSI. VASO is the better circulation program, but I don't even use our Pinnacle's automatic treatments on the eyes. I prefer to use AVA, as I'll get to in a minute, if I'm going to program a specific frequency, because the eyes are just sensitive. You know, you don't want to hit them with too much power. You'll see all of our treatments for eyes tend to be really short as well as a part of that. And then AVA 2 hertz. So this is a new one I added on for this one because it's something that, you know, we've not really done a huge amount of before, but it does come up with clients. You know, the Pinnacle, the Pro Sport, these can program frequencies that can go down as low as 0.5 hertz, and you can actually go to 2 hertz specifically for this. So for people dealing with totally destroyed or damaged optic nerves, this frequency can be the secret weapon. It's the one to go with if your nerve itself is damaged. Okay, so the optimum units. So this whole frequency thing funnels us into whether we want to look at like different devices for different eye conditions. And the truth is, you know, really, for the most part, the Evolution is great, and it's only going to be surpassed if you need to program that nerve frequency. And even then, the 7 to 12 hertz seems to help a decent amount. But whether you have the Pinnacle, the Evolution, whatever it may be, with either of these devices, we can functionally treat all of the most serious of eye conditions. The Genesis, our baby device there, that guy can treat certain eye conditions. It can do the scar tissue and it can do the anti-inflammatory, but it's going to depend on that individual condition as to whether it's going to suffice or not. I've had a few questions about other devices like the Med Sport and the Best RSI. I don't recommend these for eyes. I mean, honestly, they're missing the 7 to 12, they're missing 77, they're missing the Gamma, the 32 to 45. It makes it very, very hard to use them for eyes, and we've never recommended using them for eyes for that reason, unless someone is like, oh, I've got this one condition, like astigmatism, I believe. You could use 121 in that because it's called acute in there. But regardless, you know, it's really, there are reasons that I don't think that the goggles are compatible with these devices. Will they work? Sure. Would I expect to get the same results? Not at all. So I just have to say that there because I know I've gotten a bunch of questions submitted prior about that. So I just wanted to kind of chime in early on. So how do we use the goggles? So as I showed earlier, it's pretty straightforward. So you're going to attach the goggles to your device. They come with a wire that's already going to be in the bag. You can plug it in. I never remove the wire from the goggles. If they will come with a wire, plug it in, you leave it in. That way you'll reduce the chance of widening the plug holes and therefore reduce the chance of causing any issues. Be gentle with your goggles. You know, they've traveled a long way across the world to get to us here. and they got a bumpy ride. So they're not prone to breaking per se, but if you're rough with them, you might break them. So I'm very careful with mine. I put them in their case, like in my zipper case, and I just keep them there when I'm not using them, and I pull them back out. I close them up and like this, and just kind of like fold them on top of each other, so they're safe with the wire wrapped around. So as long as you're careful with them, you'll be good. But what you're doing is you're plugging the goggles into the device, you're turning the device on, you're setting the mode, and you're leaving the device at the default power level. Okay, so you don't increase the power before you've put the goggles on. You're going to pull the goggles down over your eyes, and you're going to close your eyes so that the electrode is either touching the eyelid or away from it, but not touching the open eye. So don't hold your eye open and press the electrode to it. It's going to pass through anyway, so just leave it with the eye closed, okay? Then you're going to hold that plus button down on the device until you feel a tingle, and it is normal to only feel the power in one eye. Sometimes you feel it in both if you're very sensitive to these things, but for the most part, I would expect to only feel it in one eye. I know I do. It's because you've got an entry and exit point of the circuit, so you're feeling it in one place, but the circuit is complete where you wouldn't be feeling it at all. So you're going to run the device for the allotted time. You'll notice as we get into the treatments, the most common recommended treatment time is 3 minutes. So eye treatments are very, very short. I tend to time this on my phone. I get to the point sometimes where I just probably run it for 3 to 5 minutes and I don't even really notice, but it's the way to go there. Number 5, right, final step, make sure to adjust the power as needed as well, right? So you want to make sure you're feeling it. So you start at the 1 power and you increase it a little bit as you go up. If the intensity gets too much, so it starts to get strong, lower the power back down. This is just your tissue lowering its resistance and accepting the microcurrent therapy, okay? So it's important to kind of understand the basic stuff here, okay? So what you want to do is you want to apply the goggles like this, clip them up, and then with them set on there, you would increase the power until you can feel that tingle, and you're going to just leave them on, okay? And at that point in time, you're just going to wait for the time to be done and adjust the power down as you need. So super, super easy to do. Super easy. All right, so let's get into the conditions themselves here, shall we? So in the following section, I'm going to discuss each individual eye treatment and how to perform it with the required tools. So keep in mind that for at least 80% of eye treatments, you'll require at minimum an Avasia Life Evolution device. Most, if not all therapies will require the goggles. Thinking about it, there is two protocols that do not require the goggles in here that you'd be able to do for 2 different conditions.